Dr. Carpiano, you are a professor of public policy and sociology at the University of California, Riverside. You are a public and population health scientist and medical sociologist, currently researching social, behavioral, attitudinal, and policy factors underlying vaccination uptake and coverage, as well as refusal or delay in the US, Canada, and Denmark. Thank you for joining us on the podcast yet again. I cannot believe it has been over a year since the last time we spoke about the pandemic. So again,
Indeed.
thank you for taking the time.
Well, thank you so much for having me. It's great to be here. Great to be back.
Yeah, it's great to be back. I'd love to just get the ball rolling. There's been a lot of the news has been taken up by vaccines, and more people are eligible. I believe this week, every US adult is now eligible to get the vaccine. Given your expertise in vaccine refusal, what is your message to any of our listeners who may feel hesitant about receiving the vaccine?
Well, it's a very complex issue, and there are. I think before I get into specifics about that, I think it's very important to just define the terms in a sense. And the first thing I think we all need to be aware of is that hesitancy is a very complex phenomenon, and it affects people in many. People are hesitant for many different reasons, and we can think about it as existing on a spectrum. So it's understandable why certain people might have some sorts of hesitancy towards vaccines and just maybe some questions based on things that they see online. Some concerns about the fact that they think that the vaccine was developed too quickly. It was called Operation Warp Speed that produced it, which certainly created some concerns even among people who are generally pretty pro-vaccine about lots of things too. But I do want us to, I think sometimes there's this broad brush sort of term that gets painted across the entire vaccine hesitancy population, where those individuals are being labeled as being anti-vaxxers, and I don't think that's an appropriate term. When we use that word, we're usually referring to people who are on a very extreme end of the spectrum, people for whom vaccines are very much part of sort of their core beliefs and their core identity, and often get into very political types of activities around vaccines and vaccine legislation, and might even engage in activities like perpetrating or producing disinformation online, and creating falsehoods and myths, and being involved in different types of efforts to misinform the public too, in those sorts of extremes. Now that's a very small, still very heterogeneous, lots of variety in that population too, but a very small, very vocal minority. So for this broader population, so now that we've gotten that out of the way, there's lots of individuals that have questions, and it's completely understandable. And everyone should be willing to listen and to hear what exactly that their perspectives might be. And that's a very important step to try to get at some type of understanding. One of the first things we should to emphasize is to people is the fact that the vaccines are incredibly safe. They're incredibly well monitored. They are incredibly effective. And also, I mean, it's important to think too that it's going to be vaccines that are going to help us to get back to a semblance of normality of what we had pre-pandemic. And it's important to recognize that it's just not something that somebody does just for themselves. It's something that you're doing for other people. A vaccine prevents an infectious disease, and infectious diseases are very different than how we're normally used to the diseases that we might usually get in the United States, in terms of things that just might affect me and me only, or you and you only, related to heart disease or cancer, and things that you can't necessarily spread to other people. But in this case, as the name implies, we can give it to other people. It's an infectious disease, and so by being vaccinated, we are helping our families, we're helping our communities, and that's something that's really quite important in terms of reducing my risk for getting it. Means that the chances, and all of us doing that, reduces the chances of transmission I mean, we're still getting, of course, the understanding of to what degree people might still be able to spread COVID even after they're vaccinated. But the fact is that the more people that are vaccinated, the less chance that there is for spread to be. And so this really is something that we're all in it together. This is a crisis that we're all facing, and we're only going to get out of it through doing something that's collective for our communities and for our families and our loved ones.
You kind of touched upon it and you reassured us, but some, like as you know, some Americans may still not plan on receiving the vaccine and instead are depending on herd immunity. Can you clarify this concept and speak on what herd immunity would really look like?
Yeah, so herd immunity is a very important component to vaccines for infectious diseases because well, no vaccine is 100% protective against a disease, and so we need as many people as possible to be vaccinated in order to provide additional protection to reduce those other sorts of opportunities that we might have for infection. And also, there are going to be certain individuals that aren't going to be able to receive the vaccine. Well, in this as we're set up right now for the COVID vaccine, that's going to include children, but there's going to be some adults who can't receive it as well as there are for other vaccines. There's different sorts of contraindications, different types of medical conditions for why people might not get a vaccine, and so it's very important for other people to be vaccinated as a way to provide protection to those other people who can't get the protection immediately from the vaccine itself. And so the higher the percentage of people in a population who are vaccinated, the less opportunity that there is for any sort of infection to spread. In this case, COVID. And so through that, and for different diseases and for different types of viruses, there are the percent of the population that needs to be vaccinated is going to be will differ, but things that are more that have greater potential for spread usually require a higher percentage of the population to be vaccinated. Measles is a very good example of that. We're still sort of figuring it out for COVID, but generally what people have been saying, what the experts have been estimating around is around 80% is what is sort of a good ballpark for where we need to aim for. And so I think that's a good sort of collective challenge for our country. But also I think it's important for us to remember too that the news might report herd immunity in terms of a sort of a national type of goal that we've achieved. I don't know, 80% of Americans are vaccinated. I look forward to that day to get that type of news. But we have to realize the fact of that herd immunity is really a function of the location of what you're talking about. And with infectious diseases, everything is local. It's somebody who is, even when we think about California, if we talk about herd immunity here, we do have to keep in mind that that different sorts of coverage rates, even at a state level, is going to mean that there's going to be lots of variation still at more local levels throughout the state. And so that's going to mean that not everybody is going to be in every part of California is going to have going to be at the same level of coverage as we're going to see sort of at what we might see at the state level. And so as a result of that, we have to be thinking about too how we can get Riverside County to be to get to herd immunity levels. We have to be thinking about how even our local communities. This is the main issue that always comes up with when it comes to child vaccinations, and why people get very concerned when we see schools that are below particular rates of coverage, because we know that just by being social environments and people engaging with each other, that there becomes the opportunity for a spread in a local area in that regard. So again, herd immunity, very, very important, but we have to also be thinking about it as not just some sort of statewide goal or a county level goal, but we really do have to be thinking about it in terms of, sometimes herd immunity is referred to as community immunity. And I think that is sort of a nice way to be thinking about it in terms of how really it it is something where we should all be invested in it, and we all get something out of it.
Yes. So herd immunity means still get your vaccine if you can.
Exactly.
Perfect. I'd love to shift a little bit. There has been a lot of talk about vaccine passports. If the Biden administration will require it, even what it looks like internationally. What can you tell us about these vaccine passports? And do you happen to know where the nation, but also the international community stands on this issue?
Yeah, this is the it's amazing when we think about, over the past year, how many different issues have just popped up that are sort of new or kind of old ideas, but some sort of new 21st century variation on them that now we have to think about in a whole different sort of way. And vaccine passports are sort of the latest chapter, I guess you could say, in the COVID novel, the tragedy that it's been. In that, in a sense, vaccine passports are nothing more than really either electronic or paper type documents that indicate that you've been vaccinated, that an individual has been vaccinated. So it's a fancy way almost of thinking about your vaccination card if you've been vaccinated already, and in many respects, it's it's a very fancy name, I guess you could say, for even that one piece of paper, which in essence is in itself a vaccine passport. Now, where that's gone more, where this is kind of, I guess you could say, the discussion around has been much more amped up. It's that it becomes a lot more than just people possessing a card, but people having some sort of certified proof of their vaccination.
Mhm.
And so there's different ways that has been proposed in terms of things like app type devices, some sort of electronic certification that you could carry on your phone, so that you could go to different places and it could be scanned, and that would enable you to go to a resort, for example, if we think domestically in terms of domestic travel, or go to a concert, or some sort of other, maybe a sporting event, some other sort of collective crowd event, where there'd be a potential for transmission. But where it's really received much more sort of significant attention is in respect to travel, international travel. Um, we've heard the debate. Well, I shouldn't just say it's just that, but I think that's really where we are seeing a lot of force behind it. Well, certain states, there has been, like, for example, Ron DeSantis in Florida, the governor of Florida, has said that that he made an executive order against any sorts of efforts that might be put underway to require a form or some sort of variation of a vaccine passport in order to for Florida businesses. And we might be seeing that popping up in particular states throughout the nation. It's going to be interesting to see how that might play out for so many different things, whether it becomes mask mandates or for vaccine priority protocols. United States has been very much sort of a 50 state plus the territories and DC experiment in terms of seeing how things might get rolled out, and so much variation across the country with this. And at this point, the federal government has taken a very sort of hands-off attitude towards it, and saying that they're not going to be sort of involved in that, and has really shown a sort of reluctance in being sort of the main source of the regulation, like we might expect for regular travel passports, for example. However, so this is where it gets the button. This is where also we get into international travel now, I guess, to complicate things. Well, there are going to be other countries that are going to require, understandably so, they don't want people showing up and bringing infection into their countries, and so they're going to want to be able to monitor and surveil, the status of people entering and leaving and whatnot. And so as a result of that, they are going to be requiring documentation. That the EU has already been making a move towards some sort of vaccine passport type system. And so it's going to come down to, in a sense, a lot of external forces, I think, on Americans in terms of their, if you want to go travel internationally, just to say, hey, I don't believe in them, isn't going to be good enough to get you into certain countries. And in a way, I mean, there's a big sort of to do about this, and in some cases, I think a little bit of um, hyperbole, I guess you could say, in terms of some of the arguments around this. When you consider that there are lots of countries already where travelers have to show evidence of getting certain vaccinations before they arrive, and so this is really not all that different. Issues have been raised about privacy concerns around this. But honestly, I think that's sort of a weak argument as well. When we think about all the different sorts of private information that we have, things even that we might even already have, on the web or tied to our social media accounts or things like that, to the extent to which somebody might find out that you've received a vaccine is not really exactly I would say, the most like high risk, high stakes sort of information, I think, to be revealed if that goes public. I've received both of my shots there. I've just said it publicly and I've outed myself there. I seriously doubt that that's really a cause for some sort of identity theft kind of argument that goes along with it. So there's these external pressures from different countries, that could certainly affect things, from flying to the cruise industry. We could imagine to certain island nations where that are the regular stopping points, ports of call for different cruise ships. Sailing out of Florida and sailing out of North Carolina and California, all along, on both coasts. We could see that certainly being an issue of demanding that of travelers. And then also, to the extent to which we will see this, not just maybe for nations in terms of different ports of call and at airports, but also just in terms of the free market. I really think that we're going to start to see lots of different pressures from businesses to require this. So again, resorts within the United States, for example, or concert venues and stadiums. And there have been for months now, even before, I believe, even before there were any EUAs ever issued for any of the vaccines. They might have still, I'm trying to remember if they were even, the trials were still underway. People were already talking about different, there are different businesses and how this were really some different opportunities for startups to try to create different types of electronic identification to indicate your vaccination status. So it's with these different types of pressures, I think government is going to have to respond in one way or another. And I don't think that necessarily just this forcing of, or these executive orders is going to be the way to go about doing it. It's sort of interesting. There's sort of this weird, or sort of, I guess you could say, ironic, maybe it's paradoxical, or whatever sort of term you want to use for it. But people who are arguing the most about government, it seems government staying out of stuff, and particularly related to COVID and issuing orders, seem to be the ones that are going right to government and wanting government to intervene when it comes to these what seem to be heavily sort of market-related sort of pressures around vaccine passports. So there's these interesting sorts of contradictions that we see in terms of the political discourse that's occurring with this. And as with so many things now that we've seen with the pandemic, that, well, in some cases things that shouldn't have been, but to the extent to which government runs public health, we see that a lot of public health activities get brought, this sort of political lens or these kind of political angles get brought into lots of public health decisions too. And so, but once again, in a way, I mean, I think it just gets back to some just fundamentals about public health and these tensions that always exist around individual freedoms versus the rights and the safety of the collective. And that is something that is to the core of public health. It is what legal precedent around public health law has continuously sort of supported and taken the side of. But it's a very sort of foreign concept to a lot of Americans when we think about how that libertarian streak of Americans, really that it's something in the it's in the DNA of our nation in a way. It's what cast off the king and and the monarchy for the revolution in a sense. And so it's been a characteristic of American culture since its founding. And and obviously, there's some people who subscribe to that more than others. But when it comes down to these issues, particularly around infectious diseases and pandemics for such public health threats that we are not used to seeing in our country, that we've been very fortunate to been able to escape. Not to say that we haven't had things like the AIDS epidemic, or issues related to worries about Ebola coming over, or H1N1, or other, or sexually, others. We think of sexually transmitted infections in general, or bad flu seasons. But to the extent of something this sort of extreme, that's now become a major killer of Americans in just 1 year. This is a very different sort of situation. And strangely, while this should have been a situation where, and I will confess, I think when you had me on, I think a year ago, I might have even been talked about this, that this might have been a situation where we thought, well, this will probably take some of the wind out of, I'll take full ownership of this, where, because I did say this to some people, this might take the wind out of some of the anti-vaccine movement and people that are really involved in that, and those campaigns. And no, really what we've seen is sort of this, we've seen an amplification of those, of this kind of pushback. We really thought that there might be what we really thought originally, the sort of a more fundamental, was that there was this idea that a lot of anti-vaccine sentiment exists because unlike a lot of other nations, we don't really get to see, aside from a bad flu season or maybe a measles outbreak here and there, we really don't get to see, the real extreme effects of infectious diseases. It's really sort of an American kind of privilege in a sense. And so now with this sort of event coming, that this should have been like the wake up call. But no, we really see that this is actually, it's kind of gone, sadly, in a counterproductive sort of way. And in many respects, sort of sentiment around personal freedoms, around what's called sort of the health freedom movement, the idea that personal autonomy, and that any of these sorts of public health decisions are somehow a violation of personal freedoms, and some infringement upon some fundamental basic rights as Americans, is really, that's really been amplified and politicized in many sorts of ways, to an extent to which we've not seen before, and in very concerning sorts of ways. Particularly as we're seeing it now really going tied in a lot more to right-wing, extreme right-wing types of positions and extremist type groups in the wake of the Capitol insurrection, and really how public health is getting bundled up within these kinds of anti-government sorts of sentiments, and in some cases activities. So.
Yes, just as a final question, bringing back to the anti-vax sentiment, with the pause on the Johnson & Johnson vaccine, with discussion on blood clots, do you think that aided the anti-vax movement of, see, we're right, even though numbers have come out, statistics have come out saying, there's a greater chance of getting blood clots with A, B, C, and D. Do you think that hurt public health even more?
Yes, but it's also not the first incident. I mean, we had it didn't affect the United States, but internationally there's the issues with the AstraZeneca vaccine as well that came up. But we've seen, I mean, nothing is going to be perfect. No vaccine is perfect. There's no such thing as zero risk when it comes to vaccines. There's incredibly low risk, and that's why they get approved, not just the COVID vaccines. And so unfortunately, we respond, and we sort of, I would say, we sort of hone in, or we missile lock onto the negatives, onto the fear, without looking at the positive in front of us. And I mean, the thing I think it's important to emphasize is, I mean, 6 cases got picked up out of how many millions of doses. I mean, if that's not a testament to our public health system and the surveillance that we have in place, the vaccines are incredibly well monitored. When we had the trials going on, when there was just some weird sorts of side effects that popped up. Things for in just one person, things were stopped and things were looked at. So everything was done very carefully. Nobody wanted to take any risks with this. Even though, and nothing in a sense is new. These are based off of sort of existing technology and existing sorts of vaccine platforms, which enabled us to do really incredible things within a year's time, which is really amazing. And we can say that the name Operation Warp Speed did not help things for vaccine hesitancy, but the program itself was very much a success. And that should be that should certainly be recognized with that. But along with that, and more straight on to the point about your question is, so what I'm trying to say is there's always going to be these incidents that occur. Whether they are tied to the vaccine or not, we're still sort of determining what's going on with this. In this case, the FDA took a very precautionary approach to this. Mm-hmm. And did not want to take any chances with it. They could have very well have just sort of continued and enabled. I mean, in fact, that's a risk trade-off. Some people have argued even that maybe we, given the risk of COVID and taking a vaccine out of play, that you're now putting more people at risk by doing that than you would be by than anything of these sorts of side effects. But unfortunately, in terms of doing all this sort of very careful activity, issuing these kinds of pauses to make sure that everything is going on right, thinking about the reputation of and how that could something bad could even spill over onto other sorts of therapies and devices that the FDA reviews and approves, and what that might mean for public confidence. I really do think that they did the right thing, and lots of other people in public health have made that same argument. But there's lots of second guessing, and there's nothing that's sort of a clear equation that you can just then check in the back of a textbook to see if you're right or not, sort of thing. These are always sort of up in the air. But unfortunately with that, when that happens, anything is going to be used as fodder for people who are either skeptical in sort of a genuine way, and just might not know and just be have a sort of general level of just their knowledge on these things isn't clear. But people who have very sorts of disingenuous interests in terms of pushing different anti-vaccine sorts of agendas, as we see with the anti-vaccine movement again and again. This stuff is going to be totally taken and used. Now, the extent to which this is going to be used to paint a broad brush towards all the vaccines that are currently available too is certainly up for question, as is the extent to which this is going to undermine public trust in just the Johnson & Johnson vaccine. So I am worried that people, once this gets resolved, and no matter what comes out of this, even if they just say, okay, certain individuals we don't recommend it for certain individuals, and we'll only give it to other people who don't fit certain criteria or whatever. I could still imagine that we might see public trust might be such that there's going to be some people who are going to vaccine shop. So if they're finally able to get they get their appointment and they see that they're only able to get the Johnson & Johnson vaccine at that site, do they not show up? Is there going to be sort of a bottleneck at places that only have the Pfizer vaccine, for example? So there are those types of concerns, but these things are always going to pop up. And when the reality of it is that the system worked as it should, and this is really great, and we should be really proud of that. Ironically, too, I think again these are a lot of where you hear a lot of what also gets bundled up in a lot of what we're seeing now with some sort of this kind of COVID denialism are there's lots of politics that get bundled up in it that are unrelated to vaccines, and things around sort of which one would think are usually hear a lot of rhetoric about American exceptionalism and about how wonderful and great America is as a country. And so, go USA sort of with some of these more sort of extremist sort of right-wing types of subcultures where we're seeing a lot of kind of anti-vaccine. It's not to say that everybody is of that, but we've certainly seen in recent years that the anti-vaccine sort of movement itself has skewed a bit more right wing. And so I always think that there's a sort of a strange irony that those are the type of people that think that America is sort of the greatest nation in the world. They might even think about it in a religious sort of sense with it, that it's God's plan for the United States to be so great. Well, if that's the case, then shouldn't our science and shouldn't our doctors and our scientists be the very best too? And so shouldn't we then, in that case, we should have extreme, hand over our heart sort of trust that that they're doing the right thing, and if they're saying that something is safe, that should be good enough. Unfortunately, it isn't, but
I
unfortunately,
I
that's
think
the
that's a great
circumstances.
point. I think that's a really great point that you made. So thank you. I mean, I think I agree. I think we should focus on that they were 6 cases and that we caught them, and that the FDA and the Biden and his administration took a precautionary approach. And unfortunately, some people will use it, to spread fear and disinformation, but they caught it, and I think that's what matters. So I just want to thank you so much, Professor Carpiano. You've made so many wonderful points. I learned a lot about herd immunity and the vaccine passports, and I'm interested to see what these next few months look like with traveling and trying to get back to normalcy. Yes,
Yeah.
fingers crossed for sure. So just thank you so much for joining us again, a little 1-year anniversary. I really appreciate it.
Well, thank you very much for having me back. And unfortunately, we had to be back talking about these things again. But
We'll have to have you back.
if you have me back again, yeah, let's hope we can be talking about other less threatening sorts of things. But I mean, and sadly, I mean, we are at a this is in many respects, COVID is going to be with us. It's in so many respects, this is the new normal. So the extent to which how much of that new normal looks like the old normal, is very much, I think in the average American sort of hands at this point. We have the capacity to be able to, with the vaccine, with other sorts of measures. As New Zealand has shown us, as other countries too. We have the capacity to have a fairly normal sort of life again. That's not impacting us and is not overcrowding hospitals and being a major killer of Americans. And so it's really it's now in our country. Well, it's always been in our country's hands in many respects, but it very much so is we're not out of this yet.
Exactly, but hopefully soon, and hopefully everyone who can does get their vaccine. And yes, we will have to speak again on a different topic, hopefully, once things are more under control. So just thank you again.
Thanks for having me.